very trendy right now, and I'd love for you to comment, is red light therapy.
All of these products that were in the market claiming to be anti-aging, they were not utilizing this novel science to target aging. Almost 5 years developing the research behind OneSkin to discover this novel peptide, which is the first time that any ingredient out there is validated to reverse the age of the skin. We found the data that the skin under or above our eyes is 20 to 30 years older than the skin around the temple or our cheeks.
Skin health and sleep are so kind of intertwined. Welcome to the Save Yourself podcast. I have an amazing guest today, Carolina Oliveira, PhD. She is the OneSkin co-founder and CEO. She is a PhD. She is an advocate for healthy aging. She did her doctorate in immunology, and then she relocated from Brazil to Silicon Valley to pursue her goal of using science to help prevent age-related diseases. Under her leadership, OneSkin has made significant strides towards this mission, starting with their proprietary OS01 peptide. Is that the right way to say it? OS01? Yeah. This is the first peptide scientifically proven to reverse skin's biological age. I am so excited to get into the science of this. Carolina, thank you so much for being here.
Yeah, thank you so much for having me, Dr. M. It's a pleasure.
So tell me a little bit about how you even got here. What made you want to pursue this and make it kind of like your life's mission?
Yeah. So, as you know, I'm a scientist by training. I was always fascinated about science and the ability to understand things, how things works in our body from a biological standpoint. So I went on and I got my major in biochemistry, and I remember studying how the DNA is regulated and how everything is fine-tuned in the way that eventually things stop working and we can figure out how we can, fix them. And then I got my PhD in stem cell biology and tissue engineering, which is an area that I'm really excited about because it has so many potential translation to help humans in many ways. And once I was finishing my PhD, one of the ways that we thought that we could translate this science to bring something to help humans was by growing human tissues in the lab out of the stem cells. So at that time, we could grow mini hearts, mini brains, mini skins.
Wow.
And then we could use these models to test the efficacy and the safety of like new drugs or new products. We ended up getting more traction from the cosmetic industry that at the time needed to completely ban animal testing. So I ended up like specializing in growing human skins in the lab. And that's how I ended up coming here to the US. I was already an entrepreneur back in Brazil with three other colleagues. We actually started together when we were finishing our PhD. And eventually in Brazil, we didn't find an opportunity to keep the business going, but we were accepted at this accelerator here in San Francisco, which mainly helps like scientists to start their business and to become entrepreneurs, which is really helpful because as a scientist, you are not trained how to start.
Yeah. It's like learning Chinese.
Exactly. And so you have no idea where to start. And back in Brazil, people couldn't like talk the science and help you with the business. So we were struggling a lot while here in the US. These people were really expert in helping you on the science front. So you could find a product market fit, we could find a business model that was actually scalable and could become, a successful company. So when I moved here in 2016, basically we decided to use these models of skin to test products that were in the market, like anti-aging products that claim to rejuvenate the skin, we saw that, okay, the market is massive, but we still don't feel that consumers trust most of the products that are out there. And unfortunately, a lot of products are really based on empty claims. And we decided, okay, can we help like validate the efficacy of these products? So one way that we thought that we could do that is by measuring what we call the skin's biological age. Have you heard of like biological age?
Yes.
Yes. So our tissues, we have our biological age. That means like the health of the, how functional or how healthy is that tissue. So based on that, we can read the DNA of the skin and we can determine, okay, this skin is like 40 years old. So
Mhm.
we can measure the age of the skin, and then we can test any given product and we can measure if a certain product is reducing the age of the skin. So it's a more quantitative way to evaluate the efficacy of anti-aging products. And what we found out was really interesting, that kind of as expected, most of the products, they did not reverse the age of the skin. Some of them didn't change, some of them actually accelerated the age of the skin. And then we started like studying a lot more about aging, and we realized that the science of aging has evolved so much in the past like 10, 15 years. We now understand much better what are the main drivers of aging at the cellular level. And all of these products that were in the market claiming to be anti-aging, they were not utilizing this novel science to target aging.
Mhm.
So they are basically targeting the symptoms of aging, or maybe the surface level signs of aging. So the fine lines, then wrinkles, and they can ameliorate some of those signs in the short term, but they are not addressing what's driving aging underneath at the cellular level in the deeper layers of the skin. And then basically we saw an opportunity to shift our approach from like testing products to now looking for new molecules or new ways that could actually target aging at the source and promote a more significant effect in rejuvenating the skin. And it was very interesting because being here in the Bay Area in Silicon Valley, we saw the inception of this new research around longevity and targeting aging as the primary value proposition of several companies. And we saw so many companies addressing aging to target Alzheimer's, to target cardiovascular diseases, and no one was using that same approach to target skin aging, which already has obviously a massive market. The consumer is eager for something new, but no one was connecting this new science with skin aging. And we also saw, okay, skin is our largest organ. We should also treat this, our skin, as a way to protect ourselves as we are, growing older, and optimize our skin health um, for the long term. So that's how we decided to shift our approach, and we spent almost 5 years developing the research behind OneSkin to discover this novel peptide.
So when is it that you came out with the is it the OS01 peptide?
Yeah, OS1. So we discovered OS1 around 2019. So 3, 4 years of research in, and then once we found a novel peptide, you needed to do several things. One is to validate safety. We need to make
Mhm.
sure that this peptide is not going to cause any toxicity,
Mhm.
any unexpected result. And the other things is efficacy. So we validated the efficacy in the lab, in the skins that we were growing. So one of the things that we validate is that when we treated like aged skins with this peptide, we could actually measure an age reversal effect in 2.5 years in the skin. So we could
Wow.
quantify this age reversal with this peptide, which is the first time that any ingredient out there is validated to reverse the age of the skin. And then this is published in a peer-reviewed journal, and it's really exciting. It just shows that aging is actually malleable, and when you know where you need to address, you can promote this age reversal. So we were really excited when we found this data, and that's when we decided to formulate this peptide into a topical formulation, a topical lotion to bring it to consumers, and we brought it to the market in 2021. That's when we launched our first product.
So, obviously, skin cells in a petri dish is different than a human that's using it. So, I'm sure now you have some human studies where people are using it. How often are they using it? And what were the results of that?
Yeah, no, that's a great point. I think the models that we have in the lab, they are the closest that we can have in vitro in the lab
Yeah.
to try to predict how this product will work in humans. And just to explain how important that is, uh, because I think the lay consumer has no idea how things can impact the skin. So when
Yeah.
we're developing a formula, so we found this peptide, and then we want to add other ingredients to make sure that we are optimizing the formulation, and we want to deliver more benefits to the skin. We want to deliver moisture, we want to deliver antioxidants. But if you load the formula with a lot of actives, a lot of times you can induce like an overreaction in the skin, and the skin doesn't respond well. And we can see this in the lab. So we can see clearly that the skin is getting more inflamed, is getting irritated, and it is what's going to happen with humans if we were to launch that formulation with like too many actives. So sometimes you really need to be careful with like how many actives you put.
Hmm.
And unless you have a model like we have to predict this in the lab, or unless you go to clinical studies and you are going to find out in humans, which is way more expensive. Unfortunately, a lot of the formulas get out in the market, and then a lot of people have, reactions like sensitization, irritation, because you would think that, okay, this active can be antioxidant, this active can promote this benefit, and you put
Hmm.
all of them,
Hmm.
and you expect, okay, I'm just delivering more results, and it's not what happens. A lot of times the actives, they cancel each other in terms of the benefits. So it's a very meticulous process, and it's a very important one that really guarantees that first, we are not delivering anything that's causing any damage or irritation or any potential side effect to the skin. And second, we can already predict that this is gonna deliver the benefits that we hope our customers will see. So once we validated this in the lab, which usually takes around 12 months at least. For the first product, it took like years, but then we go to clinical studies. So clinical studies, you usually recruit, you work with a third party clinic, and they recruit the participants, and they are usually blinded. They don't know which
Hmm.
product we're testing. We usually have a placebo control.
Hmm.
So for example, for our first product that we want to validate, what was the impact of this peptide on top of the formula that we were already developing? We had like a split phase study. So half of the phase had the full formula, but without the peptide, and half of the phase had the formula with the peptide. And it was really interesting to see that only the side of the peptide had a significant improvement in the barrier of the skin, the barrier function, had a more improvement in fine lines, wrinkles, in elasticity, and this is with the addition of one molecule. So we were really excited to see that this peptide
Mm.
had a significant impact. And so what our customers what our studies showed is that after and 12 weeks, so the results gets better after 12 weeks. We always recommend people to use at least for 12 weeks. You are
Daily?
daily, twice a day, morning and night.
Twice a day. Okay.
Yeah. You are gonna see your skin like becoming more even in terms of tone, improve the barrier of the skin, meaning that you're gonna hold more moisture, mainly now in the winter, like improving your barrier function is super, super important. You're gonna increase elasticity, firmness, and you're gonna also diminish fine lines and wrinkles. The fine lines and wrinkles, these are, takes longer. So we usually ask people to use for at least 12 months. But again, because this is such a gentle formula, has no harsh ingredients and no exfoliants, it's still really impressive that we can improve the signs of aging without causing, again, peeling, exfoliation, or any kind of side effects. And in the lab, when we compare with one of the gold standards in anti-aging, which is retinoic acid or retinol, see that the levels of collagen and hyaluronic acid induced, it's similar to retinol, but retinol usually induces inflammation, irritation,
Yeah.
and our product does not. Actually, our product lowers inflammation and calms down the skin, soothes the skin. So
So is this for someone who is, say, in their 40s, 30s, late 30s, 40s, early 50s, whatever, and they're trying to figure out the optimal skin regimen to prevent aging, fine lines? That's when you start to notice, some
yeah.
things changing in your skin, especially on your face. Um, is this something that we're supposed to be using in combination with other products? What is like an ideal skincare routine for someone who's like listening or watching to this that might say like, okay, I don't do anything. What do I do? Like, is there a simple kind of step-by-step regimen that you recommend?
Yeah. So that's why we created this line. We saw that there was an opportunity to simplify the skincare regimen because it can be really overwhelming. If you go to
Yeah.
buy a moisturizer, and then you have toners and then you have serums. And for us, like, what would be the minimal amount of products that you would need to have a healthy skin without overcomplicating? And so for us, and you can find all of them at OneSkin. And for those who want to add more steps, you can add other layers on top of what I'm gonna share. But for us, it's very simple. You have a cleanser that should be a gentle cleanser that should not like strip your skin from the oils, from your microbiome. That's super important to keep your skin healthy. So our cleanser is very gentle, promotes like a mild exfoliation, but it does not dry out your skin. And we usually recommend cleanse your skin only at night, because if you cleanse at night and you apply your products in the morning, your skin should be clean, unless you have a very oily skin, and then you could do the cleansing in the morning. But in general, one time cleansing only, it's okay. You
So
don't.
like cleansing only at night, so not washing your face in the morning. That is like so part of my routine. Like, as I'm growing up, it's brushing my teeth,
Yeah.
washing my face, so for me, is it bad to wash your face in the morning?
It's because the more that cleanser, usually they will have some kind of mild detergents that can remove like the oils that are important
Mm.
to keep your skin moistured and the microbiome. So if you can avoid disrupting that, so in the morning I only rinse my face, or if I'm showering, though I'm showering.
Yeah.
But in the morning, I usually rinse my face with water instead. As I said, unless you feel that your skin is oily and that you needed to remove that oil, then you could use a cleanser. But we try to recommend it to avoid in the morning to kind of protect that microbiome.
Wow, this is going to be big news for a lot of ladies.
I know.
Cleanse at night and not in the morning. Okay,
Yeah.
keep going.
I used to double cleanse as well.
Yeah.
Now I
Yeah.
I only do in the night. So okay, going back to night, and then and then after you cleanse, you apply like a face moisturizer. That's like the product that we developed. That's the essential one that if you needed to pick one, that's one that you're gonna use morning and night, and you apply, on a clean skin, and that's it. If you want to go one step further, we have also an eye cream that has a higher concentration of the peptide. And the reason why we develop an eye cream, and a lot of people say, do I actually need an eye cream?
Mhm.
Well, we found the data that the skin under or above our eyes is 20 to 30 years older than the skin around the temple or our cheeks.
Whoa.
I know, it's shocking. So we know that the skin is thinner and obviously
Mhm.
it's moving all the time. And because of that, it accumulates more damage. And because it accumulates more damage and it's more delicate, we needed to develop a formula that was more potent, but also very, very gentle. Like we don't want to cause irritation.
Mhm.
So this is a completely different formula from the face product, but also has a more concentrated version of the peptide. And when we see the collagen data and the clinical studies, it is the formula that increases collagen the most. So for those that are already seeing signs of age around your eyes, we do recommend the eye cream. For those that are just preventing, still don't have like, you can keep simple and just maintain with the face. The face is also safe to apply around your eyes. And you can apply both like under and on your eyelids as well, because we know that the eyelids will start to sag and droop. And then so you can help prevent that if you start like treating earlier.
So what about someone like me who has been using a retinoid cream for a while? Can I use this in combination? Like I've been using the sunblock
Yeah.
that you have, and I was wondering that for myself because I know that they do similar things, but do they work in conjunction or is it one or the other?
No, that's a great question. They actually do complementary things. I think
Okay, good.
the way that retinol works is basically, well, it will activate several receptors in the skin and induce like cell renewal. So for some people, they are going to see the skin peeling. Some people just adapt and you don't peel anymore, but you are always inducing that cell renewal. So it's really for smoothing out like the fine lines and wrinkles again, because the surface is getting renewed.
Hmm.
So you can combine with OneSkin. It's completely, they work together really well. As I said, sometimes retinol will cause irritation. OneSkin will calm down the irritation.
Hmm.
So a lot of people use in
Okay.
conjunction. Some people replace if they cannot
Hmm.
tolerate retinol,
Hmm.
they can go only with OneSkin.
Yeah, it's very irritating, and it can make your skin very dry,
Yeah.
and that's something that I've found to be annoying about it. Okay, so cleansing at night, in the morning, what are we doing? Just water and then what?
Yeah, water and then the face moisturizer and the sunscreen.
Okay, no
And
vitamin C.
so our sunscreen has already vitamin C and
Hmm.
has four other antioxidants. And we did compare the level of antioxidants in our sunscreen with like other vitamin C in the market, and they are comparable. So
Cool.
if you just want a basic vitamin C for, the antioxidants, our sunscreen provides that. If you're looking for issues more like pigmentation and you need a really high concentration of vitamin C, then you can, add another layer of vitamin C before the sunblock. But if it's just like a normal vitamin C, ours are providing that. Again, we are trying to simplify, so we loaded
Yeah.
our sunscreen with antioxidants.
Okay, I have a loaded question for you because this is something I need to put to bed. What is your opinion on oral collagen for skin? Because I think there's so many people who say it's amazing for skin. And then there's another group that says, oh, it's no different than eating more protein in your diet. So you're the expert. What do you say?
Yeah, so there is, unfortunately, the studies are still not conclusive. There is indication that the supplementation with collagen will improve your skin quality, moisture. So the collagen, basically, when you intake collagen, you cannot guarantee that that collagen that you are intaking is gonna go to your skin,
Yes.
right? Obviously, we have collagen in our tendons, in our
Mhm.
joints. So your body will send that collagen to whatever is needed. But the collagen per se is already providing like the building blocks that you need for your skin to rebuild collagen. And the collagen itself is also antioxidant. So there is a benefit of consuming collagen compared to just protein in general. And there are studies that show that this can improve your skin quality. Again, it's not 100% conclusive, but there is also no, side effects of taking
Mhm.
collagen. So if you can add, and I think this will also be a little bit personal. Some people will notice more results than others. It's not a
Interesting.
bad. Mhm.
Do you take it just as a out of curiosity?
That's interesting. I was thinking about this yesterday. I'm
Yeah.
not taking it recently. I'm taking more like whey protein, but I was
Yeah.
like, if I'm taking whey protein, I maybe should like, have one scoop of whey,
Yeah, yeah.
scoop of
That's a,
collagen.
but that's an issue with all of these things, right? Because I think what happens with me is I travel a lot. I'm so busy. I can't be doing everything. So I'm trying to pick and choose the things that I actually think will
Yeah,
make the biggest difference. And so it ends up being, more of the whey protein or,
yeah.
something rather than all these other things. But that's why I was asking. And then the other thing that's very trendy right now, and I'd love for you to comment if you'd like, is red light therapy,
Mhm.
infrared light therapy for the skin and hair, especially for the skin. And I think it's kind of had a moment right now. And I was wondering if that's just a trend or you think there's something behind this.
No, there is something. There are a lot of studies showing the impact on red light in skin, and it works by improving the cellular function in this low dose of like light. They can be helpful for activating the mitochondria, so your skin can improve its function and will perform better. I would say that there is so much out there, and I'm not like an expert in all
Yeah.
the ice, but you needed to be careful with like the dose. If you do
Yeah.
too much, it can be a little detrimental to your skin. So you needed to know the right dose, not too much and not too little to not have an effect. And I think as most things, it's about the consistency. So if I do once or twice, I won't probably see any results. Like you needed to do for a few months, and at least I would say 3 to 4 times a week.
To
But
see a difference.
yeah.
Okay, so the OS1 peptide, if you're using that every day on your skin, how, like, when we talk about nutrition, lifestyle, all this other stuff, exercise, all these other things, how, what is the optimal things that people should be doing to kind of optimize their skin um, through nutrition, lifestyle, exercise? Is there some recommendations around that?
Yeah, I mean, I think one of the main things about the skin in terms of lifestyle is obviously be mindful about sun damage,
Mhm.
pollution, all the environmental stressors, right? So right now, for example, we are in winter, right? And in winter, our
Mhm.
skin tends to be like dehydrated.
Mhm.
So what are the things that we are doing to try to prevent that dehydration? Because dehydration means that your skin barrier will be compromised, and you are going to lose more water, and your skin tends to be more irritated and flaky. So things like avoiding like hot showers,
Mhm.
avoiding too much heater, or using a humidifier. Another thing that I think is a good tip is like damping your skin before applying your moisturizer, so it
Mhm.
will lock in moisture better. All the other things that we know is sleep super important,
Mm-hmm.
exercise super important. Stress can really affect and manifest in our skin. I would say the gut microbiome, how healthy
Mm-hmm.
your microbiome. You know that a lot of skin issues they come up when you have a dysbiosis.
Mm-hmm.
Something is not right in your microbiome. Um, Let me see what else.
Yeah,
Yeah.
I think for me, it's like I can even tell the difference if I didn't sleep well for 2 or 3 days and you see it in your skin. It's like immediate almost. And I don't know if it's just in my head, but I really do feel like skin health and sleep are so kind of
Oh,
intertwined.
yeah, no, 100%. I would say that sleep is almost like number one, exercise
Yeah.
number two. The other thing that also impacts is alcohol consumption
Oh,
as
yes. And smoking, right? Like
smoking.
even I just did a video on vaping, and I think the problem that I've seen, especially when I'm traveling and I'm going to all these places, so many people are vaping. It's like become so vogue. And what I've realized is like, I think there needs to be more awareness around, nicotine itself is not good for your skin. And so you might think it's better than smoking, but you're still damaging your skin.
100%. Yeah, that's causing a lot of oxidation in your skin. And smoking is actually one of the worst things that you can do for your skin. It's one of the main uh, drivers of aging, and there are many studies showing that.
Yeah, I think one thing I did want to ask you also is what are these zombie cells? Because I don't think a lot of people know what a zombie cell is and why we should care about them.
Yeah, and that's an important thing to know because we're all accumulating these zombie cells throughout our body through this aging process. So zombie cells or senescent cells, they are basically old cells or dysfunctional cells, cells that have accumulated a lot of damage and they stop working properly. So it's interesting because when these cells accumulate in our joints, they are associated with osteoarthritis. These cells accumulate in our heart, they are associated with cardiovascular disease, in our brain with like Alzheimer's. So, and basically because we are accumulating those cells that are not functioning well, and what happens is that they start secreting inflammation and they induce the cells around it that are healthy to become zombie as well, to age faster. We like to compare them with a rotten apple in a bunch. So when you have a rotten apple, you spoil the good apples.
Mm-hmm.
That's what the zombie cells are doing in our bodies. And that's why OneSkin developed this peptide, and even other companies in the longevity space are trying to find a way to decrease the load of the zombie cells in our bodies. And there are amazing studies showing in animals. We don't do any study in animals, but when you can deplete from like an old mouse, all of the zombie cells, the mouse is completely rejuvenated. The mouse is like running around, has no cancer. So it is one really important driver of aging and age-related diseases. And that's why we in the skin, we want to avoid the zombie cells because we know that they are not producing more collagen. They are secreting inflammation. So they are inducing the healthy cells that should be producing collagen to stop working well. And eventually they are going to lead to these signs of aging. They're going to lead to the sagging, wrinkles, because collagen is breaking down. You have more inflammation. So OS1 was founded after we screened like 900 peptides and we tested in cells that were zombie cells or they were, old skin cells. And we could see that when we treated the cells with OS1, we reduced like around 40 to 50% the number of those old cells. And then what happens is that the healthy cells can proliferate, they can multiply, they can basically bring your skin to that young state that will be more functional, will lead to a stronger skin barrier, will produce more collagen again, will lower inflammation because you don't have those old cells secreting inflammation. and that's how in the end we can measure this age reversal effect, because now you have a fewer of the old cells and more of the healthy and young cells.
So interesting. This is like, where science meets aging. So just shifting gears, I'm hearing you talk about this journey, and one of the things I'm feeling really curious about is like your entrepreneur journey. You mentioned it a little bit, like you were in the lab for 5 years and trying to figure this out, and then you finally launched it in 2021, correct?
Yeah.
So where are you now with this, and where are you going?
Yeah, I mean, this entrepreneur journey is a roller coaster as
Yeah, tell me about it.
yeah, I well, first of all, coming here to the US with like zero knowledge
Mhm.
of how to start a company, I could barely speak English, and I didn't know a single person in San Francisco. So
Wow.
came here like with one dream and one goal, that's like this is the only chance that I have to make this dream a reality, and it's gonna work no matter what. I'm gonna give my life and soul. And it was really really hard in the first year, because again I needed to prove myself over and over. I'm in the middle of, like, I'm the most competitive place in the world. Like, people
Hmm.
here are super smart, like what I have that these other people don't have to offer.
Hmm.
So it was definitely a time of my life that I got to know my limits. And then when I thought that okay, now I got to my limit, like I learned that I could push it further. And
Yeah.
just like teaches you how to build resilience. And when you are doing everything that you can, you just like keep pushing, and eventually one door will open for you, and you hold to that opportunity, and another person will trust in you. And it's hard because you are gonna hear more no's than yes, and but eventually some people see that you can do it, and they will bet on you. So that's how we got here today, was yeah, was basically overcoming a lot of these challenge. But I think what made us succeed, if I look back and if I compare with other, maybe other companies that were in the same process that I was, and unfortunately they didn't succeed. I think we had a clear vision of how we could add value, create something very unique, that there was a huge market opportunity. So when you are starting out, sometimes you have an idea and it can seem like brilliant, but if people don't see the value, or if they don't want that, like you can create the most amazing product, and it may not go anywhere. So I think having the vision of, for example, this area of longevity, we knew that longevity would become mainstream. We knew that skin should be part of this conversation. We should think of our skin in the same thing, the way that we think about nutrition, right? Like, I needed to know
Yeah.
the quality of the things that I'm putting on my skin. This is an organ. So what are the companies that will be talking the same language and using the most advanced science to connect with this new mindset of like optimizing your health, optimizing your life. And so I think we had this vision that helped us to connect with the right people, that eventually when we had the product in the market, the way that we grew was not by connecting with influencer. Was these were like KOLs in the space, like
Hmm.
David Sinclair,
Hmm.
Harvard longevity expert, Tony Robbins, writing a book about the latest
Oh, yeah,
technology.
you were in that book, right? That's
Yeah,
amazing.
exactly. So these were the people that initially talked about OneSkin, that help us really to get traction, to take off, and that help us to really overcome like those challenges of like fundraising. Like, a lot of
Hmm.
times we had like fund just like for a month or two, and you needed to figure out, okay, how I'm gonna keep this going, and you needed to find investors. And so it's a crazy journey, but I think right now we were able to overcome what we call like the death valley. That's like
Yeah.
you can die at any moment. So
Yeah.
now we have over 150,000 customers, and we are
Amazing.
proud also to report one of the highest retention rate for a skincare brand. We know that the people really are trying new products every day, but our customers, they trust the science, they see the results, so they keep coming back. And now we are in a really good place that a lot of people are interested in OneSkin. There's a lot of excitement about the science, about uh this new area that we are talking about, of like connecting skin with your health, and putting all in one bucket, and not only about the beauty and what makes me look good today, but eventually can maybe harming my skin in the long term. um
What is next? Are you guys coming out with a new product or anything new coming?
Yeah, we have new products coming up. We have an exciting one now in March. I cannot share yet.
Okay. Okay, cool. Maybe when this is coming out, we'll have some more information.
Yeah, but yeah, at OneSkin, our goal is really to continue to evolving the science and translating the science into better products to our customers. So even we don't envision to create like too many new products, but to create better versions of the
Hmm.
that we
Hmm.
have, in a way that our customers can rely. If there is any novel way that we can address aging, OneSkin will be ahead and will bring this, and we'll validate with our clinical studies, and bring it to customers faster. So
Are you the sole founder or there's two founders, right?
now we are four co-founders.
Okay.
I'm one of the four. We're all from Brazil, women, really proud of this women-led and scientific team.
Love it.
And yeah, no, it's a beautiful story how we all got together, and we
And you're still friends. I mean, that's a woman story right there. Like,
yes.
if you're still, together after all these years. Um, well, I am so excited for everyone to kind of hear not just about, OS1, but really about your journey, about the science behind it, what really causes aging. And if you had one tip for people who are interested in kind of helping their skin age, or I guess anti-age, is there one thing, if you could do no other, maybe you alluded to this already, to do for your skin holistically, that can help you today?
Wow. Always hard to pick one thing.
Like, for example, most women, I'll tell you myself, we're overstretched, we're overstimulated, we have a 90 million things to do. We're using all these products, but somebody needs to tell us what is the top, maybe one, two, three things that without fail we should be doing for our skin.
Yeah, I think I shared already, and I think I maybe I can summarize. I would
Yeah.
say in general, less is more. So if you can revisit all of your skincare line, and if you can take a look on the products, if they're safe and gentle, and there are many organizations out there. We didn't talk about that, but for example, our products are approved by the National Eczema Foundation. There are other associations, the Skin Safe Products, and these are all organizations that are validating how clean or safe or non-toxic are those products. So I would evaluate your products, and make sure that you are not putting anything that's causing some toxicity to your skin. So less is more, and then I would keep it simple. Cleanse, moisturizer, sun protection. And if you like retinol, if retinol is not irritating for you, just make sure that you are not always causing some irritation, because a little bit of stress, what we call like hormesis, it's not,
Mm-hmm.
but a constant stress,
Mm-hmm.
constant inflammation, this is bad for your skin.
Mm-hmm.
So just observe and make sure that you don't keep like over, charging your skin, and your skin will find that balance, homeostasis, and that glow that's natural from your skin, and you don't need like 10 products to get there.
That's amazing. Well, I want to thank you so much for being here. I wanted you to share where people can connect with you, connect with OneSkin. How do we find out more?
Yeah. So I invite everyone to follow us on social media, Instagram at oneskin.co, uh, TikTok. Also subscribe to our newsletter. We share so much content about the product development, the science behind OneSkin. We invite people to be beta testers when we're developing new
Love
products.
it.
And we share a lot of longevity tips, beyond the skin as well. And yeah,
Do
check
you
us.
have a personal Instagram too, or is it mostly you go through OneSkin?
Yeah, mostly through
Cool.
OneSkin. Yeah,
Awesome.
and our website at oneskin.co.
I think this science is just so mind blowing. And I loved how you kind of talked us through it. And, also helped us in general with tips around longevity and skin aging. I think there's a lot that you can take from that, even beyond all of the research that you're doing. So I want to thank you for being here. I'm sure. So personally, I've really loved the sunblock product because it's a zinc oxide product, which is great because it's a physical sunscreen. I loved that it's simple ingredients. It's very easy on the skin. It's like, I mean, I love getting morning sun without anything, just brushing my teeth but then I live in Scottsdale, Arizona, where there's really harsh sun, even if you're out and about. And so that's when I think this product has been really great for me. So I want to thank you personally because I've had a great experience.
Oh, thanks for sharing him, and thanks for having me again. This was a delightful conversation.
Yes, we'll have to have you back. Thank you so much. Take care.